Imagine this. Your 3-year-old daughter's hair just stops growing for an entire year. Is it something serious, or could it be something else entirely? Today we're jumping into a medical mystery that all starts with one simple, worried observation from a mom. This sentence right here, this is a direct quote from the doctor's notes. She has not needed a haircut for the last year. It's so simple, but wow, it really captures that quiet, creeping worry that brought this family in for answers. It perfectly sets the stage for our whole investigation. So let's meet our patient. She's a happy, healthy, totally normal 3-year-old girl. Full of energy, lighting up the room, but there's just this one thing her parents have noticed. Her hair, which is this fine blonde hair, seems really sparse, and it just isn't getting any longer. Okay, so let's look at the evidence, the case file, if you will. We've got a healthy 3-year-old, her diet's good, she's hitting all her milestones. But when the doctor does a gentle hair pull test, about 10 to 15 strands come out really easily, with no pain at all. And then, here's a huge clue. Mom says she had the exact same thing when she was a little girl, and it just went away on its own. So, with these facts on the table, the doctor basically has to turn into a detective. It's time to take all these little clues and start piecing together this puzzle. This is where you have to be really systematic. The big question is, what's really going on? Is this something to worry about, or is there a much simpler explanation hiding in plain sight? To figure that out, we've got to create a list of all the possibilities, a differential diagnosis. And here it is, our lineup of usual suspects. We've got a whole range of things here, from autoimmune conditions to fungal infections, even stress-related shedding. Each one has its own telltale signs. Our job now is to see which one, if any, matches the evidence from our little girl. All right, detective hats on, let's start the process of elimination. We're going to take what we know about our patient and hold it up against each suspect on this list and see what doesn't fit. First up, alopecia areata. This is an autoimmune issue that typically causes these really distinct round bald patches. But our patient doesn't have patches. She has thin hair all over. She also doesn't have the nail problems or weird exclamation point hairs that often come with it. So, nope, suspect number 1 is officially off the list.
Okay, what about tinea capitis? That's just a fancy name for a fungal infection on the scalp, like ringworm. But with that, you'd almost always see a scaly, red, inflamed scalp. Our patient's scalp? Totally healthy, totally clear. So we can cross infection off the list too.
The other suspects are even easier to dismiss. Telogen effluvium? That's major hair shedding after something stressful, like a high fever or surgery, and it doesn't last for over a year. And androgenetic alopecia, come on, that's adult pattern baldness. You just don't see that in a 3-year-old, so those are out.
So after we've ruled out all those other possibilities, there's really only one diagnosis left standing. It fits all the clues almost perfectly. But for that final, satisfying aha moment, the doctor just needs one more piece of evidence. And there it is, the final piece of the puzzle. The smoking gun was found by looking at one of those easily shed hairs under a microscope. It confirms everything and finally solves the mystery for good.
The diagnosis is loose anagen syndrome, or LAS. Now, I know that definition sounds really complicated, but all it really means is that the part of the hair root that's supposed to act like an anchor, well, it's not formed quite right, so the hair isn't held firmly in the scalp. Think of it like a tent pole that's not stuck deep enough in the ground. A little gust of wind, or in this case, a gentle tug, and it comes right out. And remember the family history? It's inherited. That clue makes perfect sense now. And when you look at the classic profile for loose anagen syndrome, our patient is a textbook case. It's almost always seen in healthy little girls, usually with fair hair, right in that 2 to 6 age range. And the number one thing parents complain about is always the same: my kid's hair just won't grow. It all fits together perfectly. So great, we have a diagnosis. Now what? What do you do about it? Well, this is where things shift from detective work to management, and you'll see that the best treatment isn't what you'd expect at all.
When you look at the options, it's pretty clear. You might think, oh, maybe biotin supplements will help, or some other powerful drug. But nope, they don't work because they can't fix the basic structural problem of that weak anchor. The issue isn't a deficiency or an illness. That's why, by far, the most effective tool is just education and reassurance.
And this is a fascinating part of the whole story. The kids with LAS, they're almost never bothered by their hair. They could not care less. The person who's really feeling the stress is usually mom or dad. They're the ones worrying. And of course, that's completely understandable.
It makes supporting the parents just as crucial as keeping an eye on the child.
For any parent hearing a new diagnosis, there's really only one question that truly matters. Is my child going to be okay? And in the case of loose anagen syndrome, the answer is an absolute 100% resounding yes.
The outlook here is fantastic. First, it's benign, meaning it's harmless. It's also self-limiting, which means it just goes away on its own, usually by the time they're a teenager. Most importantly, it's non-scarring. The hair follicles aren't damaged at all. The potential for a full, thick head of hair is still there, just waiting for those roots to get a better grip as the child gets older. So in the end, the best medicine for loose anagen syndrome isn't something you get from a pharmacy. It's understanding. It's knowing this is just a temporary phase, not some scary, lifelong illness. And that knowledge, that peace of mind, is everything.
It really makes you think, doesn't it? How many other things are out there that we worry about, things that seem so scary on the surface, but actually have a simple and totally reassuring explanation? For this little girl, the solution wasn't some miracle cure. It was just knowledge. And that's a pretty powerful thing.